BPH is a big problem that is prevalent in the U.S. with a total addressable market of approximately 40 million, with approximately 12 million men under treatment. In the urology office, we often perform a test called the Uroflow. Unfortunately, it is not in the most ideal situation, and a company out of Utah called StreamDx came up with an in-home solution, and we are going to talk about that relative to the urology office from a business and workflow perspective in this video. Hello, my name is John. I am a urologist in Gilbert, Arizona, your host of the Thriving Urology Practice Facebook group, where we come together to help each other so that we can survive in this crazy healthcare game. All right, today we are going to talk about StreamDx. It came to my attention from one of the posts by one of the members on the Thriving Urology Facebook group. I looked into it. It's a novel test to me, and I actually called the StreamDx team, and I spoke with the CTO, the Chief Technology Officer, Scott McClellan, at length today regarding the technology, the founding, and also the coding and billing aspects. Now, I am no expert, and I will fully disclose that interpretation when it comes to coding and billing is subject to CMS rules and also your private payer rules. I am simply providing my knowledge and understanding regarding the billing and coding aspects of StreamDx. Okay, when it comes to Uroflows in the office, the patients are asked to come in with a full bladder, and they're asked to void into this machine that is recorded. It records the flow rate, how long it took for the patient to void, and the flow volume. It is in an artificial environment in the urology office. Often, the patient does not come in with a full enough bladder, so we are getting a less than optimal test. Well, StreamDx came up with an in-home solution where the urologist's office will order the actual StreamDx test, and StreamDx will mail a Uroflow device with the funnel and all the instructions directly to the patient's home, where he will keep the device and use it for about 7 days, during which time he will use the device hopefully multiple times during the day and throughout multiple days. At the end of about 1 week, the patient will then mail just the bottom part, the transducer part, it's called the puck, put it in the pre-addressed envelope and send it back to StreamDx in Utah. StreamDx will then receive the puck, take the information from the puck, put it through their portal in a nice readout with a comprehensive report, and then this allows the urologist to log in, either print it out through PDF or print it out on paper, and then for interpretation and subsequent billing. This will allow more reliable capture of Uroflow data, and there's some business opportunities for obviously StreamDx and also for the urology office. So that is pretty much the workflow when it comes to actually obtaining results. From the time of the urology office ordering until the results are made available, total time is about 11 days. A couple of days for shipping to and from, to the patient, and a couple of days for the puck to be returned to the StreamDx office, and then about 7 days for the patient to actually use the device. Now, the business case is that the billing when it comes to 51741 or complex Uroflow occurs per day of use. And as you know, it doesn't reimburse much, maybe $15 or so. And to avoid stark issues, the charge to the urology office is per order, not per day of use. So that's a very important distinction so that StreamDx can stay in compliance. The urology office, depending on the rate negotiated with StreamDx, will pay a set amount to StreamDx for that one actual test, and then depending on the number of days the patient uses the StreamDx, the urology office will then bill per date of use with the site of service 12 home for the use for the performance of the test. When the urologist logs in, or the office staff logs in, and the urologist interprets the results, she will then attach the appropriate ICD-10 to the 51741 for appropriate billing. And once again, it is per date of service instead of having 51741 quantity 3, 4, 5, 6, or 7, depending on the number of days used. So I do not recommend that you bill it that way, because your payers are probably going to subject that to multiple procedure reduction, even though it shouldn't be. But the best way, I think, to do it is to bill it by the date of service so that you are appropriately paid for the interpretation of the results. The other thing that the other CPT code that is potentially helpful to the urology office is a new code called Chronic Care Remote Physiologic Monitoring that is put out by CMS. It became effective January 1st of 2019, and that code is 99457. There are some criteria that you have to meet to bill for this code, and I think on average it pays about $50 or so. It is not a big, high cost, expensive test, but it allows the staff of the urology office and the physician to provide remote monitoring of, for instance, 51741 results and bill for this service. It requires clinical staff and or physician and or advanced practice provider to provide at least 20 minutes, equal or greater than 20 minutes of service per month to bill for this particular line item. So in total, it depends on the number of Uroflows that the patient actually performs per day, and then multiply by the number of days, plus or minus 99457, depending on if you actually will bill for that in your practice. That is how you come up with the total amount of reimbursement to the urology office when it comes to the StreamDx test. Use cases, I think it will be useful or helpful for the urologist to use this test, maybe order this test and use this test before and after medical therapy, or before and after surgical intervention, to document efficacy in a natural environment such as the patient's home on repeated studies, and that you can then interpret the results in a more effective and more accurate fashion than just a one-time test when the patient comes into the office. I mean, ideally, it would be nice to have multiple studies to get validation. So in my opinion, I think it is a valuable test for the urology office. It's another piece of weapon that we can use to diagnose and treat urinary difficulties among men and some women. There's also the opportunity to use it in a chronic care remote physiologic monitoring perspective when it comes to CMS coding and billing. And lastly, it is from a business perspective, it is a low risk and but relatively low return type of a test for the urology office. But I think it does seems to provide a valuable set of information for the urology practice. So that is it for the urology business perspective and workflow. If you have any questions or comments, leave them below. And if you are watching this on YouTube and you like the video, give me a thumbs up and like the video. Lastly, from an investment perspective, if you are an investor in startup companies like this, briefly, the company was started at the end of 2014, 2015. And in January 2019, they started launching the test. And I think their first customers were around March of 2019. So it is still fairly early on, but the results seem promising. The total addressable market is quite large with an okay return ROI if you are an investor in startup companies. I will put in the video description below the link to StreamDx and also the link to their video description of a video link to their description of how the test is actually performed. Thank you so much for watching. Take care.